Today, see about neurosurgical instruments. Okay, first we see about the basic neurosurgery instruments. Among the basic, what are the basic neurosurgical instruments? First one, general instruments. So, identify this instrument. Okay, so what is the name of this instrument? So, it is brain needle. Okay, the purpose of this instrument is to use to establish a trajectory in the brain toward a particular site. Okay, example, ventricle for CSF drainage or mass for biopsy. Okay, whenever you want to make a pathway to the ventricles from the cortical surface or dura, you can use this brain needle. Okay, especially if you when you are putting EVD, external ventricular drain. Okay, and when you are doing VP shunt, you have to put the cranial end of VP shunt to make sure the ventricle is we are reaching the ventricle by using this brain needle. Okay, and we also used to take mass from the biopsy from the mass. Okay, and the other use is it has a smooth end. Okay, the smooth end and the shaft, it allows less traumatic trajectory through the brain tissue. That is the main issue. So, okay, it has very smooth end. Okay, so that makes the trajectory pathway very smooth and with less trauma. Okay, so it has a stellate. Okay, you see, this is a stellate. Okay, it has a stellate, can be removed to confirm the position or can be used with the navigation system. Okay, for stereotactic guidance. Okay, it is a use of the stellate. Okay, you can remove the stellate to confirm it is in the ventricle to see whether the CSF is coming out or not. Okay, by remove the stellate, or it can be used with the navigation system in case of stereostatic biopsy also. Okay, this is a brain needle and its uses. Okay, number second. So, identify this. Okay, identify the basic material used in the neurosurgery. We can't this in the general surgery. Okay, this is especially they use in the general surgery, neurosurgery. So, this is called patty. Okay, this is called cotton patty. Okay, alternatively they call it as patty or strip, or they can call out this by the measurement of the patty. When this is the full patty, suppose they are giving this half size, this can be called as the half by half. Okay, okay, or cotton strip or patty. The many names are there, alternative names are there. What is the main purpose of these patties? It is more commonly used in the hemostasis maneuver. Okay, involving gel foam, Surgicel, other hemostatic agent. Okay, the patty is placed over the agent. Okay, we have to place the patty over the agent and then suction draws. Okay, we either blood or fluid facilitating coagulation. Okay, so we can't directly suck the blood. Okay, or fluid which is present in the cortical surface. Okay, because the suction will suck the brain tissues also. Okay, for that purpose we have to keep this on the surface, and we have to suck on the surface of this patty. Okay, so that we can able to see where the bleeding is coming from. Okay, how to achieve the hemostasis. Okay, where to coagulate. Okay, so it is a one surface mat. Okay, used in the during surgery for brain. Okay, and it can be used to apply bone wax atraumatically, and it's also used as either a wick. Okay, what I have told before is to draw fluid away or as a protection barrier over the vital structures. Okay, and it has a radiopaque strip. See, this is a radiopaque strip. Okay, down the middle. Okay, so we can also check. Okay, we can also check whether suppose we have to keep some patty inside, we can able to make it out. Okay, by using the radiopaque material. Okay, it has some other varieties. It has available in many spaces, many shapes, square, rectangular, and multiple sizes. Okay, depending upon our uses. Okay, where you are trying to remove the tumor or where you are trying to do the dissection, the size of the patty can be varied. Okay, so this is cotton patty. Cotton patty is main use in the hemostasis, suction, and to put bone wax atraumatically, and this is a protection barrier. Okay, and what are the other names? Next, what is this instrument? Okay, this is a Workhorse instrument for the neurosurgery. This is Fascia suction. Okay, Fascia suction. They can also call it as a Poppen suction. Okay, what is the purpose? It can be used for suction. Okay, can be used for suction, and it can be used as a thumb hole. Okay, allows on and off style of suction. Okay, this is a thumb hole. Okay, we can open and close varies, the speed of the suction is varies, okay. So, the speed of the suction varies. Suppose we close the suction, the speed is very high, it will suck the materials in a very high speed and more forces, okay. Negative force will be more if you block the hole, and if you open and do the surgery, the negative pressure will be very less, okay. You can use it and depending upon the vital structures areas, okay. Suppose you are going to operate in the very vital structures, so we should not close the hole, okay. We should open the hole and do surgery because it will suck all the material, okay. And it also used as a retractor. Sometimes we can use it as a retractor also, okay. When a retractor not available, so the surgeons always keep the suction either on one hand, either right hand, left hand. The neurosurgeons always keeps the suction on one hand, okay. It is a workhorse for the neurosurgeon, okay. So, and he will do a dissection using the other hand, okay, instrument using other hand. Suppose he can't able to, okay, we can't able to hold the retractor at the time, we can use this suction material, suction as the retractor, okay. And production device sometimes, or it uses the blend dissection tools also, okay. We can use use a dissector also, blend dissector also when removing the tumor or brain parenchyma. So, it can available in a straight or angled form, okay, and various diameters of the tips, okay, depending upon the area we are going there, okay. For spine surgery, the diameter of the suction is different, and for cranial surgery, the diameter is different. In the cranial itself, when we are going in the vital structures or undergoing deep non-elegant structures, elegant structures, the diameter of the tip varies, okay, for the suction material. So, we can use it varies according to it, okay. Next instrument. So, identify this instrument. This looks like a scissor, okay. Okay. So, it's not, but it's really not a scissor. So, it is a clip applier, okay. It is a hemoclip applier, okay. Its alternative name is Liga clip applier and vascular clip applier and vessel clip applier, okay. So, it is a basic clip applier. It's used for applying small metal clips, okay, metal clips for occlusion of the vessels, and it can multiple size of the clips is available for a diverse range of the vessel sizes. So, it depend upon the varied clip sizes. This clip applied size also different. It's available in the variable lengths. Next, identify this. So, this is irrigator, and we can also call it as Asepto, and somebody it's called as a bulb syringe, okay, and a big irrigation and a flush, okay, water, okay, and Asepto syringe, okay. So, the purpose is it is a refillable bulb syringe used for irrigation of the surgical site, okay. So, we always use this bulb syringe to irrigate the area, okay, to irrigate the dissected area, okay, whenever you are dissecting the brain parenchyma, okay, and whenever you are going to wash, give irrigation, and it is also especially used in evacuation of the chronic SDH, where we are irrigate the burr via this using this bulb, okay, and we evacuate the chronic SDH, collected clots, everything will come using this irrigator, okay. So, this is also very important basic instrument used in neurosurgery. Then it can be available in multiple sizes and multiple shapes also. So, identify this. So, this is basics only. You can also use general surgery also. We can use this material. So, this is your Kitner, okay, otherwise called peanut. Okay, and simply we can call it as peanut, but its real name is the Kitner. Okay, the purpose is a small rolled up gauze, usually held by the Kelly or Kryles or mosquito clamp. Okay, and it is used to dissect bluntly or to clear areas for improved visualization, okay. So, it is also often used to clean tissues of the bone, okay. Example, in prevertebral tissues, okay, when you are dissecting the prevertebral tissues in the ACDF procedure, anti-cervical decompression fusion procedures or lamina, or when you are going to put a screw on the lamina, we have to clear the superficial tissues, which is adherent to the lamina by using this, okay, peanut, okay. Why the purpose of it can be used, okay, it can available in a single or multiple packs, okay. This is your peanut or Kitner. Next, so identify this instrument, okay. So, this instrument is used to hold and giving clip like this. So, it is a Ranis applier, okay. The Ranis applier, otherwise called Ranis clip applier, okay. So, Ranis clip we will use it in the neurosurgery, especially in the scalp to prevent the blood loss, okay. So, you can use in the flap, okay. You can use in the scalp flap, okay, to prevent the blood loss. So, it is also called a skin or scalp clip applier. The application is application of the Ranis clip to the skin flap edges during craniotomy for hemostasis. Okay. So, it is available in the reusable form also and it is disposable form also. Okay. So, this is your Ranis clip applier. Okay. Next, identify this instrument. So, this instrument is, it has a long stem, okay, and it has a handle, okay, and you see a hole in the edge, okay, hole in the tip. Okay, this is the instrument is called shunt washer. Okay. Okay, especially you have to use when you are in the procedure of VP shunt. Okay. So, its alternative name is also called guide. Okay. The purpose is designed for subcutaneous passage of shunt catheter, and whenever you are insert this tunnel, I can also call it as a tunneler also. Okay, whenever you used to insert this guide, there should be, we have to be very cautious because when using this passage, it can pass through the fascia and putting vascular and vital structures at the risk of injury. So, usually we insert in ventricular peritoneal shunt, we insert this guide from the abdominal end. Okay, insert from abdominal to the cranium via subcutaneous space. Okay, in the subcutaneous space and the abdomen, thorax, and in the neck, and then go to the cranium. While going to the neck, it can injure the vital structures also. It can injure the carotid arteries. Okay, so and jugular veins. Okay, so you should be very cautious while inserting the subcutaneous guide. Okay, and it has a hole in the tip. It allows catheter to be sutured and secured to passer. Okay, so it is often accompanied by a plastic sheath. Okay, so it have various lenses are available for adult or pediatrics. The shorter lens can also used to pass electrodes in functional cases or for the creation of subcutaneous tunnels for bypass grafts. Okay, so it can available in various lenses and it is reusable or disposable. Okay. So, next identify this instrument. This is your suture boots. Okay, there are many names: rubber bands, clamp boots, and a catheter holder. Okay, this its purpose is it has a small rubber tube for clamps that prevent the serrations from damaging. So, what is being held? Okay, so it's often used to handle a shunt or pump catheters. Okay, is used to handle the shunt. Okay, and used or pump catheters, because it will cover the serrations. Okay, the trauma to the holding object will be very less. Okay, and it's also used to the clamp sutures. Okay, since the sutures can slip through the serration of the most clamp, so if you cover the serration, we can so clamp the suture also using this. So, the suture boots, the otherwise called rubber short and clamp boots or catheter holders, we can use this to prevent that damaging from the serrations. Okay. So, to handle the shunt or pump catheters and to clamp the sutures. Okay. The shunt washer, the Ranis applier, okay, the Kitner, Irrigator, okay, Hemoclip applier, and a Fraser suction, with cotton patty and a brain needle. The blades used in neurosurgery, basic blades. So, as we know, this is a 11 size blade. Okay, the purpose of this knife is for fine and precise cutting and dissection of the tissue. Okay, it's often used for arteriotomies. Okay, and opening the dura through the burr holes, and you can use it for also harvesting the pericardium, pericranium. Okay, and it can also be used with the monopolar to make the precise holes in the dura. Okay, when in contact with the monopolar. Okay, okay, we can use this on one hand, and we can use the monopolar on the blade itself. It can give a precise incision. Okay, in the dura. Okay, this is a 11 size blade and is used in the precise cutting. We can use it for arteriotomies, opening the dura and pericranium and dissecting the pericranium, and is also used with the monopolar. Okay, this is a 15 size blade. The purpose of this blade is a cutting knife for fine and a precise cutting and a dissection of the tissues. Okay, when we are going to do in the pediatric cases, we will use this mostly in the pediatric cases. Okay, for the fine delicate cutting. Okay, it's used in pediatrics, skin revisions, harvesting pericranium, and it initiating dural incisions. Okay, so these are the blades, 15 size blade and 11 blades and their uses. Next we'll move to scissors. So this is a curved Metzenbaum scissors. Okay, curved Metzenbaum scissors, otherwise called Metz, curved Metz, Ragnall tissue scissors. Okay, and curved tissue scissors. Okay, we can simply call it as routinely we call it as a tissue scissors or curved tissue scissors. Okay, this real name is curved Metzenbaum scissors. Okay, the purpose of this scissor is useful for first macroscopic cutting, dissecting, undermining delicate soft tissues. Okay, it should only be used to cut tissues. Okay, it's very important. We should not use this to cut the hard substances like sutures, okay, or the drain tubes. Okay, we can use it only to cut the only soft tissues. Okay, otherwise the blade sharpness will be lost and the instruments will be wasted. Okay, we can use only for to cut the delicate soft tissues. Okay, and its common uses including cutting and dura, fascia, and ligate vessels and muscles. Okay, so it can be available in straight also and curved blades also and variable lengths also. Okay, these were curved Metzenbaum scissors. Next, identify the scissor. Okay, it is a scissor of it's a fine Metzenbaum scissor. Okay, it is a fine Metzenbaum scissor. Okay, it's otherwise called Metz, fine Metz, and fine tissue scissor. Okay, all of the purposes are similar like that of the curved scissor. Okay, but it is the blade will be straight. Okay, useful for macroscopic cutting, dissecting, undermining delicate soft tissues. Is you only to use to cut the tissues. Its common uses including dura, fascia, ligated vessels, and muscles. Okay, so identify this instrument. This is a long curved Metzenbaum scissors, otherwise called long Metz. Okay, curved Metz, tissue scissors, curved tissue scissors. Only the length of the curved scissor is very long. Okay, the other uses are similar to what we have discussed previously. It is also used for the macroscopic cutting, dissecting, undermining delicate soft tissues, and it should be only used to cut the tissues on soft tissues only. Especially used in the cutting of dura. Okay, ligate the vessels, fascias, and muscles. So identify this instrument. Okay, this is your Mayo scissor. Okay, it's a Mayo scissor. So it's used to suture scissor, mainly used for cutting the sutures. Okay, it's a Mayo scissors. Okay, that's a basic scissors. Okay, it's a Mayo scissors. It's a long curved Metzenbaum scissor. Okay, this is a fine Metzenbaum scissor and it's a curved Metzenbaum scissor. Okay, these are the basic scissors they are using in neurosurgery and some basic sutures. Okay, so identify the suture. Okay, the mainly identify the suture needle itself. Okay, this picture is not depicting what is the content of the suture, what is the suture material. Okay, okay, just to note the tip of the suture needle. Okay, it is a cutting suture needle. Okay, so it has a triangular shaped needle tip that cuts through the tissue. Okay, so and it is a blend. Okay, it is a blend. Okay, it is a tap at the suture needle. Okay, you can also call round body. Okay, it's a rounded needle. It displaces, so it passes through the tissue. Okay, cutting needle and round body needle. Next, see about the needle holders. So it's a routine needle holder. The name is called Mayo Hagar needle holder. The other name is called Cooley needle holder, DeBacke needle holder, and Krailwood needle holder, needle driver. So various names are there. Its common name is Mayo Hagar needle holder. Okay, the purpose of this needle holder is locking needle holder used for multitude of needle sizes. Okay, and most common needle holder. This is a mostly commonly using needle holder. Okay, based upon the serrations. Okay, it can be differentiated smooth serrations or serrated jaws. Okay, it is available in various lengths also and materials also. Okay, so the other alternative names of this Mayo Hagar needle holder is Cooley needle holder and DeBacke needle holder and Krailwood needle holder. Okay, so identify this instrument, identify the needle holder. Okay, so this is what is this differentiate from the previous needle holder is the serrations. Okay, the serrated part. It also having the locking system and it is called rider needle holder. Rider needle holder. Okay, so the only difference within the routine needle cold is the serrations. Okay, this is the forceps. So this is a basic identify this instrument. Okay, this is a basic tissue forceps, that is Adscent forceps. Adscent forceps. Okay, so the alternate names are Adscent with the teeth, bunny forceps, pickups with the teeth, skin forceps, and the skin pickups, because there are various local names are there. Okay, you can use also called as skin forceps. Okay, but the real name is the Adscent forceps. The purpose of the use of this forceps is used for grasping or holding superficial tissues. Okay, especially during closing the superficial wounds. Okay, and always precise grabbing of skin edges. Okay, with the for improved tissue approximation with the minimal tissue injury, and it has a sharp teeth. Okay, can penetrate the fragile tissues and surgical materials. Okay, example shunt valves, catheters, and gloves. Okay, so you should be very cautious. Okay, so it has a sharp teeth. It can penetrate the surrounding surgical materials like shunt valves, catheters also. Okay, so based upon the number of teeth, it can be varied. Okay, it has one tooth on the other one side and two serrated tooth on the other sides. 1:2 and 2:3. Okay, like that. Based upon the number of teeth, it can be the material can be varied. That's and forceps. So identify these forceps. See the tip. It has multiple teeth. It is Adscent brown forceps. Okay, Adscent brown forceps is otherwise called brown Adscent forceps or pickups. It's a brown forceps or pickups. Okay, the main thing is it's a brown. Okay, Adscent brown forceps. The use is used for grasping or holding the superficial delicate tissues. So the interlocking tissue. What is the main advantage is the interlocking teeth here reduces the tissue injury. Okay. Okay, if you lock means it will if you hold means it will lock. Okay, so that we could not frequently use the teeth. Okay, to make the tissue damage. Okay, once it hold means it will lock. Okay, but to reduce the tissue damage. Okay, like here also it also has a sharp teeth. It can also penetrate the surgical materials. Okay, like shunt, catheter, and gloves. This is very important. Okay, these are must asking questions by the examiner. Okay, this especially they are using in neurosurgery. Okay, what is identify this forceps? Okay, this forceps is bayonet tissue forceps. Okay, what the various alternative name of this bayonet tissue forceps is simply called as bayonet or bayonet Cushing. Okay, or bayonet Cushing tissue forceps or Janssen tissue forceps. Okay, the two types. Okay, Janssen. Okay, Cushing, Janssen. Two scientists are involved here. Okay, Cushing and Janssen. The purposes, it is useful to grasp or holding the delicate tissues. Okay, it allows better visualization of the targeted tissues due to bayonet features. So it has the stem has a feature of bending. Okay, so while doing surgery within microscope, okay, so the target tissue is not obstructed by your hand. Okay, we can easily visible the targeted tissue by holding the forceps also. That is the main purpose of this bayonet forceps. So it has a bend-like surface in the stem. Okay, so it is especially useful when you are doing the surgery with the microscopes. Okay, and it has the long arms which allow to use in the deeper spaces. Okay, to especially to working in the skull bases. Okay, to hold the vessels in aneurysm surgery, to hold the head, neck. Okay, to hold the delicate structures in the skull bases. Okay, this bayonet forceps is very much useful, and it has very varieties based upon the length of the arms. Okay, so the handle will have either a rounded end, that is called Janssen tissue forceps, and it has an edged end. Okay, that is called Cushing, that allows scraping abilities. Okay, let's identify these forceps. So you see the serrations. Okay, and the length. It is a DeBacke forceps. Okay, it's also very important, and it is also useful in whenever we are dealing with the vessels. Okay, vascular structures. We are using this DeBacke forceps, and it is also useful in vascular surgery very much. frequently. So alternative names is DBAC is pickups, tissue pickups, tissue forceps, vascular tissue forceps. The purpose of these forceps is a non-traumatic grasping and holding forceps designed for very delicate tissues, okay, or vessels. It's often used in macroscopic vascular surgery, okay, macroscopic vascular surgery, okay, and it's also useful in handling tubing and other surgical implants and other cables, okay. It's very useful because it has the tip will be very narrowed, okay, so it can be useful for the holding of these surgical implants, okay, or handling with the tubing, okay, handling the tubes, okay, and it doesn't have any tooth, okay, so it will not damage the rubber tubes, okay, or efficient, okay, and other implants that we are using in the surgery. So identify this instrument, okay. This look like a bayonet with having the bipolar connections there, okay. This is a general bayonet bipolar forceps, okay. So another workhorse instrument in neurosurgery is bipolar forceps, okay. So it is otherwise called Cushing's forceps, Rotan forceps, Mayo bipolars, bayonet bipolar forceps. The purpose is it's mainly used for the coagulation of tissue between the tips of the forceps, which must be in close contact to the current, okay, to allow flow through the tissues, okay, mainly coagulation of the two edges of the forceps, okay, like what the mechanism of action of bipolar, okay. So the variable current allows highly tailored effectiveness. It can be used as a dissection instrument or for general grasping of delicate tissues, okay. Whenever the by the same thing only, so we can also use the suction forceps. We can also use the suction also as a dissecting material, and we can use okay, like similar thing. The surgeon can also use this bipolar forceps, okay, to dissect, okay, as a dissecting instruments, okay, and used to grasp, okay, any some delicate structures like cotton patty, okay. To insert the cotton patty, they use this bipolar forceps also, okay. And we have many varieties: straight, curved, angled tips. So insulated tips are not, okay, and it's irrigation. We can give irrigation or not, okay, and a short and long, and it's a blunt or fine tips. Okay, it varies. There are many different types of this bipolar forceps available based upon this whether the straight or curved or insulated, having the insulated tip or not, it having the irrigation property or not, and it having short and long and a blunt, okay, or fine tips, okay. So identify this is general forceps. It's called general tissue forceps, okay. Otherwise called a Cushing forceps, Semken forceps without teeth, okay. It is a simple non-tooth forceps and a smooth forceps. It uses in is a atraumatic forceps used to grasping or holding or retracting a counter traction, okay, used for the counter traction or stabilizing various tissue types. It's available in various sizes, okay. So identify this forceps. So it is having tooth serrations, okay. So it is Gerald. It is Gerald with tooth, okay. It is a Gerald with teeth, okay, and picks up with the teeth, okay. What you have seen before is the non-tooth forceps. Here is the tooth forceps, okay. The alternative name is Semken forceps with the teeth, rat tooth forceps, and forceps with the teeth, okay. And the purpose is it has multi-purpose sharp-toothed forceps used for same grasping, holding, retracting, counter traction, and stabilizing moderate to heavy tissue types, okay. So Gerald with the teeth. The alternative name is pickups with the teeth. The purpose is it can used to grasp or holding forces designed for very delicate tissues or vessels, okay. It used in the very delicate tissues only, and it is great for holding, okay, very important heart tissues, okay, like dura, fascia, for stabilization during suturing or retraction, okay. This picks up with the teeth, okay, and Gerald with the teeth. These two, and you can also call dural forceps, okay. Yeah, this is also called a dural forceps. You can use to holding the very important tissues like dura, fascia, and identify this instrument. This also look like a tooth forceps, okay, tooth forceps, okay. So it is a large tissue forceps, okay, otherwise called a semicon forceps with the teeth, rat tooth forceps or forceps with the teeth. It is also used to grasp the very moderate to heavy tissue objects, okay, heavy tissue types, okay. It's often used in the wound closure, okay, wound closure, but yes, but we should not use this directly on the skin, okay. Okay, but the skin tissue holding forceps is different, okay. We should not use this directly on the skin, okay. Large tissue forceps. Then identify this instrument. So this is also used in the neurosurgery. Takashi forceps, okay. This is a Takashi forceps, and its alternative is pituitary forceps or tissue forceps, okay. So what is its use? It's used to grasping or manipulating tissue during endonasal or transpenile surgery. Okay, that's why it's otherwise called as a pituitary forceps. So whenever you go doing surgery for the pituitary adenoma, okay, or any supracellular mass via the transnasal transpenile approach, okay, this instrument is easily goes, okay, endoscopically, and we can remove the tissues, okay, we can remove the mass, okay, from that area, okay. That's why it's called pituitary forceps, or otherwise called Takashi forceps. Can be also used for tissue grasping or biopsy samples in cranial and spinal cases, okay. It has many varieties based on the straight or angled jaws, okay, and variable length, okay. So identify this important instrument in neurosurgery, okay. Okay, it looks like a bayonet, but you see this tip, okay, it used to hold something very precisely, okay. So this is called Yasergil bayonet tissue forceps. Usual bayonet tissue forceps usually should not have this like this tip, okay. So here the tip is like a cup, okay. It used to hold the important delicate structures, okay. So it's otherwise called bayonet cushing, okay. So multitude of uses involving grasping and holding delicate tissues, okay. Its cupped jaws, okay, allows secure tissue purchase, okay, especially when you are holding the tumor, okay. It will hold, okay, the cup will hold the tissue purchase, and its long term allow in deep spaces, good for grasping biopsy samples and fat grafts, okay. In colleague we can also call as biopsy forceps, okay, or tumor forceps, okay. It used to grasp or hold the delicate structures, okay. Cupped jaws have a very good secure tissue purchase. It can also use in deep spaces, and it can grasp biopsy samples, can available various lengths. Let's go revision on the forceps. So your Yasergil bayonet tissue forceps. This is a Takashi forceps. This is a large tissue forceps, and this is a Gerald with the teeth. This is a general tissue forceps. This is a general bayonet bipolar forceps, okay. General bayonet bipolar forceps. This is a D-back case forceps. This is a bayonet tissue forceps, okay. This is for Adscent brown forceps. This is for Adscent brows, okay. Adscent forceps. Okay, these are various forceps that we have seen and their basic uses.